Good afternoon, everyone, and thank you for joining us today for the Skilled Nursing Facility Quality Reporting Program Review and Correct Reports Refresher webinar. My name is Glenna Davis, and I will be your host and moderator today. Before we get started, I wanted to share a few housekeeping items. This webinar is being recorded. It will later be posted to the CMS Skilled Nursing Facility Quality Reporting Program website. We will provide you with details on accessing the recording via email when it is available. If you would like to use the closed captioning, it is available for you to use throughout the webinar right below the slide screen. The phone lines for today will be on mute for the duration of the presentation. Due to the large number of attendees on today's webinar, we're unable to field questions over the phone, but you are able to submit questions electronically if you follow the instructions that we will discuss later on during the presentation. If you have a question at any point throughout today's presentations, please enter it in the form that we will walk you through. We will answer as many questions as possible during the presentation, and responses to all submitted questions will be published on the Skilled Nursing Facility Quality Reporting Program webpage. Also, an email will be sent to you when the Q&A document is available. Our speaker for today is Dr. Roberta Constantine. Dr. Roberta Constantine is a Senior Policy Analyst at RTI International. Here is an example of the electronic question submission form and the process to use to submit questions during the webinar. To submit questions, visit the web page listed on the slide. I am sharing the link at this time, or it will be shared in the chat box for you to use to submit questions. By clicking on the link in the slide deck, a separate internet browser window will open. Once you get to the landing page, enter your name, organization, and email address. After you enter your contact information, if applicable, use the drop-down menu to select the section of today's presentation that your question refers to. Type your question in the following field and then click Submit to send your question to the presenter. After you've submitted your question, you will be able to submit additional questions if you click on Submit Answer Response. Today's webinar was created specifically to help producers understand the new data submission requirements for the SNF Quality Reporting Program. We will conclude the event with a question and answer session and finally a wrap-up. Throughout today's event, we will be using polling questions. Polling questions allow the speakers to ask questions to gauge your understanding of the material being presented. Each polling question will appear on your screen. Review the answer choices offered and choose the answer. There's no need to hit Submit. Once you choose your answer, it will automatically be submitted for you. You can change your answer at any time before the poll is closed. Your answers are confidential and will only be reported in aggregate percentages. Following a brief pause, the presenter will review the correct answer and rationale for each question. This presentation was current at the time it was published or uploaded to the web. Medicare policy changes frequently, so links to the source documents have been provided within the document for your reference. This presentation was prepared as a service to the public, and it was not intended to grant rights or impose obligations. This presentation may contain references or links to statutes, regulations, or other policy materials. This information provided is only intended to be a general summary. It is not intended to take the place of either written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their content. Slides 9 through 10 in this slide deck contain a reference list of acronyms that will be used throughout today's presentation. to have Dr. Constantine on the line today. She's a very knowledgeable speaker, and we want to thank her for being here today. It is now my pleasure to turn the session over to Dr. Roberta Constantine. Dr. Constantine, the floor is yours.
Okay, thank you. Thank you, Jenna, and good afternoon, everyone. Thank you for attending today's webinar. First, let's review the objectives for this presentation. They are to discuss how public reporting fits within the Skilled Nursing Facility Quality Reporting Program, discuss the quality measures used for public reporting contained in the Review and Correct reports, review the structure and content of the Review and Correct reports, describe how to access and interpret Review and Correct reports, and finally to identify skilled nursing facility-specific resources available to providers. Okay. Next, an overview of public reporting. The framework for public reporting for skilled nursing facilities was established in fiscal year 2016 of the Skilled Nursing Facility Prospective Payment System Final Rule. Public reporting of the first set of quality measures will begin in fall 2018 for skilled nursing facilities. When public reporting begins, downloadable data will be available at data.medicare.gov. This slide provides a graphic representation of public reporting. Under the heading CASPER Reports, you see the Review and Correct reports and other upcoming reports associated with public reporting. Specifically, there are Review and Correct reports, QM reports, and those are referred in the rule as the confidential feedback reports, and provider preview reports. Please note that all of the reports are confidential to providers. And lastly, the quality measure results will be posted on the CASPER website for public reporting. Okay. All of the reports associated with public reporting provide information to providers regarding their performance on quality measures. At the bottom of the page, you see the Review and Correct reports, which became available June 2017. Above that are the QM reports that will be available in fall 2018. They will provide both facility-level and resident-level results. The Review and Correct and quality and QM reports are provided to skilled nursing facilities for the purpose of quality improvement on their quality measure performance. Last, we have at the very top provider preview reports with an anticipated launch date in the summer of 2018. In this report, the data cannot be corrected. The data are what we term as frozen. The provider preview reports preview quality measure performance results prior to public display. Next, we will review the data collection periods. The Skilled Nursing Facility Quality Reporting Program became effective October 1st, 2016. Beginning with the fiscal year 2018 payment determination, skilled nursing facilities that do not submit the required quality measure data may receive a 2 percentage point reduction to their annual payment update for the applicable payment year. Please note, it's the submission of the quality data, not the performance on the quality measures, that determines compliance. First, it's important to submit accurate and timely data for the quarterly reporting period. In the left-hand column is the calendar year data collection quarter, and you see the 4 quarters listed. In the middle column, you see the data collection or submission quarterly reporting period. So, for example, quarter 1 refers to data from January 1st through March 31st. In the last column, the quarterly review and correction periods and data submission deadlines are listed for the purposes of public reporting. And you see, for example, Quarter 1, again, the quarterly reporting period is January 1st to March 31st, and the correction and data submission deadline is about 4.5 months after the reporting quarter ends, which is August 15th. Next, let's discuss the quality reporting program and the quality measures. For the quality reporting program, types of measures are based on their data source. So first, we have assessment-based measures, which are based on the minimum data set version 3.0 or MDS 3.0. There are also claims-based measures. For claims-based measures, skilled nursing facilities are not required to submit any additional data. And also, only assessment-based measures are included in the review and correct reports. For a complete listing of quality measures, refer to the Skilled Nursing Facility Quality Reporting website at the link below. The Skilled Nursing Facility Quality Assessment-based measures included in the review and correct reports are percent of residents or patients with pressure ulcers that are new or worsened, short stay, and the NQF number is 0678, application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function, NQF number 2631, and finally, application of percent of residents experiencing one or more falls with major injury, NQF number 0674. Okay. Now, let's test your knowledge. The review and correct reports include which of the following measures? A, claims-based measures, B, assessment-based measures, C, all of the above. And Glenna, if you can let me know when I should show the answer. Give a couple minutes for polling.
It looks like we have 2% of the audience who responded with answer choice A. We have 57% that responded answer choice B, and 41% that answered answer choice C.
Okay, thank you. The correct answer is C. Only the assessment-based measures will be included in the review and correct reports. So those measures are the pressure ulcer measure, the falls with major injury measure, and the functional assessment and care plan that addresses function measure. So it's just the assessment-based measures that will be included in the review and correct reports. Okay, next. The review and correct reports that can be assessed through A, the Automated Survey Processing Environment, ASPEN, B, the National Healthcare Safety Network, C, the Quality Improvement and Evaluation System, KEYS, and D, the Certification and Survey Provider Enhanced Reports, CASPER.
Wow, we've got a lot of answers coming in. We have 11% who chose answer choice C, and then the other 89% who chose answer choice D.
Okay, thank you. And the correct answer is D. The review and correct reports are CASPER reports. Okay. Let's further describe the CASPER review and correct reports. CASPER review and correct reports contain quality measure information at the facility level. The quality measure results are not risk adjusted, and only the observed rates are provided. Providers are able to obtain aggregate performance for up to the past 4 full quarters as the data is available. The reports are available for providers to run with updated data weekly, and the data updates until the data correction deadline. For example, for quarter 1, which is January 1st through March 31st, the data will refresh until August 15th, which is the data correction and submission deadline. Also, the reports display data correction deadlines and whether the data correction period is opened or closed at the time the report is run. The next section of slides provides information on the content of the reports. I will review the information, and then you will see a snapshot of that information within the report itself. First, we have header information, and this consists of the report title, the setting, the report number, the report run date, the number of pages, the CMS certification number, facility name and address, and telephone number. So at the top is the header or the snapshot of the header. So you can see on the left-hand, upper left-hand corner, the CMS logo. Then in the middle, you see that this is a CASPER report. It's the Skilled Nursing Facility Review and Correct report, and that it's for MDS 3.0 quality measures. It's report number 1 for 2017, and on the upper right, it provides the run date and also informs you of that this is page 1 of 3 pages. In that middle section is all the facility level information. So the CMS certification number, facility name, the address, and the telephone number. Important considerations. Carefully review the data about your facility, including the CMS certification number, the facility address and telephone number, and the data certification within Aspen. The data certification is not currently on the Review and Correct report, but will be on the upcoming QM reports. And it's really important to make certain that the facility information, including the certification date, is correct within Aspen. CMS does not have the ability to monitor the validity of the Medicare certification and facility information within Aspen, nor the authority to issue a correction. If you notice a discrepancy and the information isn't current, please contact your Medicare Administrative Contractor, or MAC, to update your facility information. The MAC contact information is available at the following link. Once on the website, click on your state on the map or select it from the drop-down list below the map. Contact information for your state will then be displayed below the map. You can find your regional office at the link below. And finally, PDFs of contact information for each regional office are available at the bottom of the page. The Review and Correct reports also contain the following footer information. This report may contain privacy-protected data and should not be released to the public. Any alteration to this report is strictly prohibited. Next are the general items. They include the quality measure name, the National Quality Form number, if applicable, the CMS measure ID. You'll also find a table legend which provides important information for interpreting results. Also listed are the reporting quarter, the start and end date for the quarter, the data correction deadline, and finally the status of the data correction period as of the report run date and whether that is open or closed. So Below is an example of the general information. So what you see at the top is the skilled nursing facility quality measure name, and in this case, it's the percent of residents or patients with pressure ulcers that are new or worsened. You see the CMS ID. Then below that is the table legend, which explains the assessments that are included for this measure. And you also see a listing that says dash, that the data are not available or not applicable. So if you look below, you see the reporting quarter, the start date, the end date, the data correction deadline, and the data correction period as of the report run date. One thing in regards to the dashes, so if you take a look at the cumulative information row, the data correction deadline and the status do not apply for the cumulative time frame. So that's why you see the dash. Now let's review quality measure specific information. Again, the quality measures included in these reports are percent of residents or patients with pressure ulcers that are new or worsened, application of percent of residents experiencing one or more falls with major injury, and the application of percent of long-term care hospital patients with an admission and discharge functional assessment and a care plan that addresses function. The observed performance rate is calculated by the number of skilled nursing facility stays included in the numerator for this measure, divided by the number of skilled nursing facility stays included in the denominator for this measure. In the SNF skilled nursing facility observed performance rate is then the numerator divided by the denominator and multiplied by 100. And again, the measures are not risk adjusted for those measures that are do have risk adjustment in the measure specifications. Okay. Next is an example of percent of residents or patients with pressure ulcers that are new or worsened. Let's say at the beginning of September, you run the report. Below the table legend, here's an example of what would be displayed. So again, and you see the reporting quarter, the start date, end date, the data correction deadline, and the data correction period as of the report run date. So again, if you ran this report at the beginning of September, the data correction deadline for quarter one was August 15, 2017, so the period for the correction is closed. In regards to the quality measure display, you see the number of skilled nursing facility stays included in the numerator for this measure, and for this example, the number is 0. The number of skilled nursing facility stays included in the denominator for this measure, and in this example is 1. And finally, your skilled nursing facility's observed performance rate, which is 0%. Okay. Next, let's describe subsequent review and correct reports. After the first quarter, subsequent reporting quarters data are added. Cumulative data are displayed, and when a new reporting year begins, the oldest quarter is dropped, hence the term rolling quarters. Okay. In this snapshot, 4 quarters of data are displayed. Let's say, for example, you run the report January 1st, 2018. For each quarter, starting with the most recent quarter, quarter 4, you see the observed performance results for the pressure ulcer measure. Quarter 4 and quarter 3 are open. Remember, you ran the report January 1st, 2018, so the data correction deadlines have not passed. For quarters 2 and quarter 1, they are closed the performance results will not change and the data are frozen. Also, data for the quarter that ends is always available the next day after the end of the quarter. So, for example, the quarter ends December 31st, then the data is available for that quarter the next day, the next business day, and this would be January 1st, 2018. So, for example, if you take a look at quarter 3, ending on September 30th, 2017, data is available on October 1st. Next is an example of quarter 1 for the next reporting year. So this is an example of the rolling quarters. So let's say you run a report April 1st, 2018. This would be an example of what you may see displayed. You would see quarter 1, the most recent quarter, and that is open. Quarter 4, 2017, is also open. Quarter 3, 2017, is closed, and the data are frozen. Quarter 2, 2017, is also closed. And you notice that as that quarter advanced, quarter 1, 2017, is now dropped. For the next quarter, when that advances, say you ran the report on July 1st, quarter 2, 2018, which includes data for April 1st through June 30th, that would be seen at the top, and that would be open. You also would see quarter 1, 2018, quarter 4, 2017, quarter 3, 2017, and quarter 2, 2017 would drop out. Okay, we have more test your knowledge. When a given quarter's data becomes available, review and correct reports provide QM results that are updated on a weekly basis, B, monthly basis, C, quarterly basis, or D, annual basis, up until the submission deadline.
We have at this time, we have 49% that have answered A, 5% that have answered B, and then 45% that have answered C.
Okay, thank you. And the answer is A. So when a given quarter's data becomes available, review and correct reports provide the quality measure results, and they're updated on a weekly basis as long as that submission deadline is open. The reports display quarterly data, but they're updated on a weekly basis as long as that reporting period is open. Next question. Providers can address questions, correct inaccurate information, and ensure accuracy regarding their facility information by which of the following actions? A, contact your Medicare Administrative Contractor, or MAC. B, contact your regional office. C, none of the above. Or D, both A and B.
For this question, we have 36% who have answered A, 7% who have answered B, 5% who have answered C, and then 52% that have answered D.
Okay. And the correct answer is D, both A and B. If you have questions in regards to your facility information, you should contact both your Medicare Administrative Contractor as well as your regional office. Next question. The review and correct reports contain patient-level data for each quality measure. Is that true or B, false?
And for this question, we have 37% who've answered A for true, and then 63% who have answered B, false.
Okay, thank you. And the answer is B, false. The review and correct reports provide facility-level data. One more question, and this one's a little bit tricky. Which of the following statements are true regarding subsequent review and correct reports? Cumulative data for the review and correct reports are displayed for 1 year in rolling quarters. B, when a new reporting year begins, the new quarter of data is added and the oldest quarter of data is subsequently dropped. C, reports are retained for 10 years. Or D, none of the above.
So for this question, we have 35% who have answered A, 63% who have answered B, and then 2% who have answered D.
Okay, thank you. Okay, and the answer is B. When a reporting year begins, the new quarter of data is added and the oldest quarter of data is subsequently dropped. A is a little tricky depending on how you read it, and basically the cumulative data for the review and correct reports are displayed for 1 year in rolling quarters. Actually, the cumulative rate is displayed for each quarter. So quarter 1, you do see a cumulative rate, although it's equivalent to quarter 1. Quarter 2, you would see quarter 1 and 2. For quarter 3, you would see quarters 1, 2, and 3 listed. And then quarter 4, you would see all 4 quarters listed. So you don't have to wait for a full year to see cumulative rates. Okay, next we'll discuss how to obtain the reports. Once again, this is an on-demand report. You want to go to the CMS Key System for Providers. Next, you want to log in with your user ID and password. On the Welcome to CASPER page, click the Reports tab located in the top center, and you see it circled in red. Then if you look on the left-hand side towards the bottom, you see the Skilled Nursing Facility Quality Reporting Program, and you want to click on that. You'll see the Skilled Nursing Facility Review and Correct Report, and then you select the quarter, begin and end date for all quarters that are available. Next, you would click to view the report. And finally, resources. For skilled nursing facilities, the links below provide information on various aspects of the quality reporting program, such as the MDS 3.0 user guides and training information, There's also assessment submission, user guides, and training page on the KEYS Technical Support Office website. That should be accessing the CASPER reports. There's also the Skilled Nursing Facility Public Reporting Help Desk email, and it says it's not active yet, but it is now active. There's also the Skilled Nursing Facility Quality Reporting Help Desk. In addition, Skilled Nursing Facility Quality Reporting FAQs are listed. Information about the QRP data submission deadlines are also available. There's also the fiscal 2017 Skilled Nursing Facility Prospective Payment System final rule listed for reference, and also other certification and survey provider enhanced reports available in CASPER. Okay, now that concludes the presentation. Thank you very much for your attention, and now we can take some questions.
Thank you so much, Dr. Constantine, for sharing with us today. And I do want to let all the callers and participants know on the line about your background. Dr. Constantine is a senior health policy analyst for RTI's Quality Measurement and Health Policy Program. Her research experience includes demonstration and evaluation studies of post-acute care and chronic disease, as well as the development, analysis, and reporting of quality measures. She has a clinical training and certification as a cardiac care nurse and worked in cardiac rehabilitation. Her professional experience includes both clinical quality improvement and management positions in the acute care setting and a variety of healthcare organizations. She earned a doctorate in health policy from the Heller School for Social Policy and Management at Brandeis University. Dr. Constantine, we thank you for bringing your experience and knowledge to our participants on today's call. And with that, I'm going to start with the questions. So our first question reads, how do I access and use the Review and Correct report?
Okay. So first, what's important to understand is that these are on-demand reports, so the providers actually have to go into the key system to obtain, or into the CASPER system to obtain the reports. So directions for logging into the CASPER for these reports are listed on previous screens. So you need to log into the CMS services network, and then you access through keys and then into CASPER, and you select the quarter that you select the quarter deadline that you'd like to take a look. One thing that's important, you want to verify the quarter in the year option that displays in that end date field. And essentially, another important note is, again, the quarter and the year end date option is automatically updated on the first day following the end of the reporting calendar quarter. So, and once you are in the system, the most current quarter and year option will be displayed by default, but other older quarters and year options will also be available. So another important note is you want to know that the Review and Correct reports will remain in the CASPER folders for 60 days. It's important for providers to utilize the report while the data correction period is still open, so they can correct any information if needed on their assessments. So therefore, we really encourage you to obtain and use the reports shortly after they become available.
Thank you. Our next question reads, I cannot access our facilities Review and Correct report. Where do I go for help?
Okay. So we realize that there are many help desks, including the Quality Reporting Program and the Public Reporting Help Desk, but this is a technical issue. So if you run into any difficulties accessing the reports, then you would want to contact the KETSO Help Desk, and that is listed also on one of the slides. And you can also call them on a 1-800 number that's listed on the webpage.
Thank you. Our next question reads, when selecting a time frame for the review and correct report, can I view data for only one particular quarter?
Well, that answer is sort of yes and no. So for quarter 1, 2017, if you selected that, you're only going to see that one quarter. For quarter 2, you would automatically see data that includes quarter 1 and quarter 2 for 2017. The same with quarter 3. You would only see quarters 1, 2, and 3, but you would be able to see and focus on whatever quarter that you select.
Great. Our next question reads, how often are review and correct reports refreshed? How soon are corrections or edits reflected on the report?
Thank you. So you can look at this in a couple ways. So first of all, there's weekly measure calculations, and those for the open reporting periods, those are performed early in the morning hours every Monday. When it comes to the quarterly measure calculations, then as soon as a quarter is completed, the review and correct quality measures are calculated and updated in the morning hours on the first day following that quarter. And then finally, for end-of-quarter calculations, when a quarter is about to close, the measures are calculated and updated about 4.5 months after that quarter is completed. And so it happens in the middle of the month. So, for example, it would be the 16th day of it's February, May, August, and November. And the quarter's processed and then marked as closed.
Thank you. Our next question. So this one reads, is there a reoccurring day of the week that reports are refreshed?
Yes. The weekly quality measured data for the review and correct reports are performed in the early hours every Monday for the quarters that are still open. So it's every Monday.
Great. Okay, our next question reads, how will I know that my review and correct report is available for download? Will I receive a notification added to my CASPER folder?
Okay. Well, again, it's important to remember that these are user-generated reports, and you can request them anytime. And what happens is, similar with other user-requested reports for CASPER, the completed reports are automatically saved to your inbox folder in the CASPER reporting application.
Okay, thanks. The next question, while reviewing our facility's review and correct report, we noticed that there is an error in our report for street address. Do I contact the Public Reporting Help Desk to correct this error?
No. Unfortunately, this information is abstracted from the Aspen system, and CMS is unable to make any changes in this data. So it would be important to reach out to your Medicare administrative contractor in your regional office And on previous slides, we listed sort of the steps as well as the links so that you can contact those offices.
Thank you. So our next question reads, on the announcements for this new report, it says that these reports will allow us to obtain aggregate performance for the past 4 full quarters when data is available. Will we be able to narrow down this date range to just 1 quarter or even just 1 month? There's a significant burden if we have to review a full year of data just to get information on the most recent period.
Mm-hmm. Well, other than the first release of the Review and Correct reports, when there was just quarter 1 that could be viewed, when you request the data, you will see, like, for example, if it's quarter 3, you will see quarters 1, 2, and 3. So it is broken out by quarter. So you are able to see that data for each quarter. Unfortunately, we haven't been able, or we do not have the range just for even a month. But thank you for that suggestion, and maybe that's a consideration for the future.
Okay, so our next question reads, you said that Review and Correct reports would be available on a quarterly basis, but that they would be updated weekly. Could you please clarify if the reports are updated weekly, how are they only available quarterly?
So the Review and Correct reports display quarterly data. As long as those reporting quarters are available, then as long as the data correction period is open, then assessments can be added or corrected. So the reports are refreshed weekly or updated weekly to reflect any changes made for those open quarters. So again, the display is a quarterly basis, but as long as that quarter is open, then any data that has been added or modified will be, the quarter will be refreshed on a weekly basis with that additional information.
Okay, so the next question reads, when will these measures be recalculated following the August 15th deadline for corrections?
When will these measures be recalculated following August? So on the 16th of August, so the day after the deadline for corrections, that quarter is just closed, and that quarter will be calculated for the final time.
Thank you. The next question says, when is the freeze date again?
Oh. The freeze date is the term that actually applies to that data correction and submission deadline. So it's approximately 4.5 months after the reporting time frame has ended. In one of the previous slides, you see the actual dates for each quarter. So they're the 15th of the month, so there's August, November, February, and May, and that's listed in one of the slides. But that is when the submission deadlines are, and that is what the freeze date refers to.
Thank you. The next question says, the website is not clear if our regular MDS submissions are all that needs to be done. Are there other submission steps or deadlines that we're currently not doing that need to be added?
Well, skilled nursing facilities, they currently submit their MDS data to CMS through the ASAP system. With the implementation of the quality reporting program, it doesn't change the requirements related to the submission of the MDS data. There's no additional reporting required.
Okay. The next question says, please clarify the need to submit the data. Aren't the data being submitted automatically when the MDS is closed and submitted? What needs to be submitted?
The answer is yes. The data required for the skilled nursing facility quality reporting program are being submitted when you successfully submit your MDS assessments. Again, that the implementation of the quality reporting program doesn't change the requirements related to the submission of the MDS data through the KEYS ASAP system, and no additional steps or reporting is required.
Great. Thank you so much, Dr. Constantine. So now what we're going to do is switch gears a little bit so that we can use this opportunity to provide some clarification to several items that came up during last week's open door forum. And we have a list of questions. And the first question reads, will our facility receive a letter from CMS if we are in compliance with the data submission requirement associated with the APU? What about if we do not meet the data submission requirement?
So CMS will only notify providers who do not meet the data submission requirements. So for those facilities that do meet the requirements, they shouldn't anticipate receiving any letter. It's only for facilities that do not meet the data submission requirement.
The next question, when will confidential feedback reports be available for SNF skilled nursing facilities?
Okay, so the confidential feedback reports are those QM reports that we refer to. Right now, there is not a specific date, but CMS will notify providers once there is a definite date. Also, again, one point of clarification, the SNF proposed and final rule refers to the term confidential feedback reports, and these are the reports that, again, we term QM reports. However, it's important to realize that the review and correct reports, the upcoming QM and provider preview reports are all confidential to providers.
Thank you. Our next question, let's see. Okay, when is the last day to submit corrections for Q1 of the calendar year, 2017?
Okay. So for the purposes of public reporting, so for the first quarter of calendar year 2017, the data submission deadline and correction deadline is August 15th, 2017. So coming up next week.
Okay, wow. The next question, if my facility submits changes to data submitted for Section GG, when will those changes show up in the compliance rate on the review and correct reports?
Again, so we received this question in the past and on our recent open door forum. So we want to clarify and reiterate that the review and correct reports are not going to provide information on the reporting compliance rate. The reports are quality measure reports providing information on how a provider is performing with the overall measure at the time the report is run. So the review and correct report is truly focused on giving providers information on how they are performing on the quality measure. And if there is a link on the skilled nursing facility quality reporting website in regards to the program data submission deadlines, and there's a link for them to take a look at in regards to the deadlines.
Wow, thank you so much, Dr. Constantine. We're really, really appreciative of you joining our call today and presenting this valuable information to our SNF partners. Today, that ends our call, and we'd like to thank you all for taking the time to join us. A recording of this webinar will be posted later on the CMS SNF Quality Reporting Page website. And that's all we have for today. Thank you all so much, and I want you all to have a great afternoon.